The faculty here, they'll be there to support you every part of the way and make sure that you develop and be the best that you can be. I love the idea of being in a place where you feel comfortable, where you feel like you can do what you need to and you can thrive.
You may be on one service with 3 different subspecialty surgeons within the same subspecialty that do things 3 completely different ways, and I think that you kind of have to learn what works best for you.
You start scrubbing in for cataract surgeries as a first year, and you start participating in them as a first year. And as you slowly build on your surgical skills, you can start to actually do your own cataract surgery.
I know some programs people will do fellowships because they need to get more experience because they didn't get it in residency. That's not the case here. Residents get all the cases. They're the primary learners here.
The residents always keep us on our toes. They are young, fresh minds who are always asking the questions that sometimes we have long forgotten about, and so they keep our academic side of things alive.
More senior residents, the fellows, and then the faculty as well are always backing up the residents when they start their training here at WVU.
The feeling of support here is a very strong part of the program, and no matter what you're doing, where you are, there's always somebody there as your backup. Somebody you can go to, no questions asked, no judgment.
I feel comfortable calling any of the faculty members in the middle of the night, much less the residents and fellows.
Right where we are, we're in a special area where we have a very large catchment area. Not only do we serve basically the whole state of West Virginia, but we serve the eastern border of Ohio, we serve some of southern Pennsylvania, a lot of transfers come from Maryland.
I've seen everything from like rare genetic conditions to like extreme traumas, things that you may not see if there's a bunch of programs in a small area.
I think one of the most rewarding parts about treating patients in this area is, they don't have access to good care in most places in the state, and when they come and see you, you may be a resident, you may be an attending, you may be a fellow, you may be a medical student. To them, you're their doctor.
I've always appreciated serving the veterans. They really understand and appreciate your care. Without AVA rotation, our program would be vastly different.
You basically run your own clinic there, so you learn what it's kind of like to be an attending. There's always an attending there for questions, for backup.
Morgantown's nice. I'm married and have a 2-year-old and another child on the way, and I don't have to think for 1 second that they're not safe. I always tell people, if you don't find what you want here in town, Pittsburgh's less than an hour away.
I love the place we live. I love our neighborhood. We go out with our dog all the time. There's a lot of dog-friendly trails and dog-friendly restaurants where you can sit out on the balcony.
There's beautiful rolling hills everywhere and just an abundance of outdoor activities. I've gone down to the New River Gorge a couple times, world-class whitewater rafting, and it's just so fun to be able to do things like that so close to home.
I actually actively enjoy coming to work. I go home happy at the end of the day. I don't dread coming into work. I don't think we're ever overworked. I think that we're appreciated. The attendings like to work here, the residents like to work here, the technicians and all the ancillary staff like to work here. It's a really happy environment here.